East Surrey, we have 5 primary care networks, and each of them have got an anticipatory care hub.
I work within a team of clinical and non-clinical team members that deal with frail and medically complex patients.
For a long time, we've known that people living with increasing frailty have worse outcomes in acute hospitals. Too often, we are risk averse and we feel that bringing people into hospital is the least risky outcome.
The hospital is the right place for some people, but we do know that patients prefer to stay at home. And actually, if you've got your community, your family around you, it's more that social and mental side that supports you staying at home.
The Anticipatory Care Hubs they're amazing because they're working with the resources that are already there, but coordinating them to wrap the care around the person.
Within the Care Hub, we work as a team, so we have a GP, 2 community matrons, care coordinators and a community pharmacist.
This job allows us to really pull in a lot of people in our extended multidisciplinary team, including social care, including nurse specialists, secondary care consultants,
Physios, occupational therapists. The hospice is involved as well, because a lot of patients, they could be in their last year of life, so actually supporting them to have a good death is really important. So working together, that helps.
It's been so brilliant working with them because everybody on the team brings a different aspect of care.
But what is good with these hubs is there's a triage system. We look at patients that perhaps need to be seen within the next 24 hours, 48 hours or a week.
So Scylla came in as an amber referral.
I have struggled for quite a long time with my mobility, and I had a fall in the bathroom. I broke my wrist, I chipped my hip, but the worst bit was my neck.
Usually, the initial assessment is done by myself or one of the other community matrons within the team. We do all the medical things such as baseline observations. We would look at their social care if it was needed, equipment within the home. So it's a very holistic assessment process. We would then need to refer the patient to other members of the multidisciplinary team.
They sit round a table or a virtual table to discuss these patients, and the relevant person will just say, yep, I'll take that patient. And then it's the coordinator's role to make sure that everyone who's taken an action goes off and then does it.
One of the really important things that has come out of the Anticipatory Care Hubs has been the care coordinators.
Yeah, they are at the epicentre of the hub, I would say, and I've often told them that they are the soul of the team, because we ask them to make a lot of patient contacts, and that will be at different timelines of the patient journey. But also, over time, they've developed the skill set to see, is there something more we now need to add? Has there been a change in their condition? Or is everything stable and fine, and should we now just hold back a little bit?
The comfort of having people come in, people who see lots of people like me, who know what it's like, who have sensible ideas of how to manage things better. You don't get that with other services, to my experience. If I go to the doctor hasn't got time to talk to me like that.
The standard model of one appointment, one problem, one patient doesn't fit this cohort.
So you're thinking about their mental well-being, their physical well-being, their social needs, their environment and how that can be helped or make changes.
I think the main advantage is for the individual people who aren't subjected to A&E and to tests and investigations they don't need.
And I think it really is supporting general practice, it's supporting the community provider, it's supporting everyone, because we're working together to support these patients.
I think, gosh, this service ought to be available to everybody. It really should. It's just brilliant.